It is my pleasure to warmly welcome Dr. Darshana Sirisena from Sri Lanka, who is a long-lasting friend and colleague from Sri Lanka. Darshana, very good morning to you. As you are
Good
aware,
morning.
World Federation Neurology and Movement Disorder Society, or International Parkinson's Disease and Movement Disorder Society, commonly known as MDS, so Movement Disorder Society, are joining hands together this year to celebrate World Brain Day, concentrating on Parkinson's disease. How excited are you to see World Brain Day is dedicated to Parkinson's disease and two global movements are advocating for Parkinson's disease patients?
Thank you, Tissa. And first of all, let me thank you to giving this opportunity to be from Sri Lanka and to be speaking about this World Brain Day activities. And to start with, I think this is a great initiative of the two great organizations in the world, in the globe, the World Federation of Neurology and the International Movement Disorders Society, or what we call as MDs, as you mentioned. So I think something long due, I think, so to get the what I feel is when compared to our setup in Sri Lanka, movement disorders are people are not speaking that much of this specialty or what we call subspecialty. Maybe for various reasons we can discuss. So taking this initiative to improve awareness among neurologists, maybe among doctors, and more importantly among patients is a great initiative, and I should thank the both organizations for taking this up as the topic or the theme for this World Brain Day. I'm sure this will make, not though the global situation is not that good, but I think this will have a lot of impact on developing the services of movement disorders worldwide, especially in our part of the world.
I agree. As you know, I was one of the co-authors of a global burden disease paper that we published in Lancet Neurology 2 years ago. Parkinson's disease is almost like a pandemic. The number of Parkinson's disease patients in the world doubled from 1990s to 2016. The expectation is if the rate of prevalence increase continue to occur, this would be the fastest growing neurodegenerative disorder affecting mankind. And Sri Lanka is not different. We can talk about the numbers, and we sincerely hope the platform that WFN and MDS has created would give a toolkit for Sri Lankan neurologists, Sri Lankan physicians, allied health people, nurses, media, to talk about Parkinson's disease and raise awareness. I mean, you and me both know every month or so we make a new diagnosis of Parkinson's disease. It is the same in Colombo, same in Melbourne. That means there is an issue of lack of awareness. How do you think your Sri Lankan colleagues use World Brain Day activities before 22nd of July and beyond the 22nd of July?
Absolutely. So as I mentioned, this is a great opportunity to raise the awareness. So if we are speaking about we have a very small neurological fraternity in this country. We are practicing about 40 neurologists, as you are all aware, for 22 million people. As you mentioned, when compared to the Western world, and here I don't think when coming into numbers, there's a big difference of the Parkinson's disease. We see the same number, maybe even more. Sometimes the only issue we face in this country, what I gather from my last 15 years practice or the experience in the field of neurology, and especially in the movement disorders, we don't diagnose them as early as possible. That's one of the failures in this country. Probably one of the reasons is there are not much neurologists who are not to serve the country. So therefore, I think this opportunity for neurologists as well as for the patients to make awareness of Parkinson's disease, to come early, to diagnose them early, and to start them. Thereafter, actually, once the patient is diagnosed, it's a team effort. So the neurologist, maybe the family physician, when we call in this country, and the allied health staff all have to get together to give a better treatment or a better care for the Parkinson's. So I think these World Brain Day activities going. So we are another 3 to 4 weeks to go there for that. I think it can improve the awareness of the neurologists, the generalists, as well as for the the public. Overall, what I feel is I am being the secretary of the local law body, that is the Movement Disorder Society of the Sri Lanka. We are planning to raise many programs despite the current situation in the country. But when it comes to the COVID, we are doing better when compared to the most of the world. So I think we are going to awareness programs, maybe getting all the neurologists which are distributed throughout the island to act together, mainly to improve the awareness.
I think you raise an important point. I am also originally from Sri Lanka, and for our viewers, we should remind that Sri Lanka is a beautiful island in Indian Ocean, size-wise about 63,000 square meters, regarded as the best place to travel before COVID-19 by Lonely Planet, as it offers pretty much everything. Sri Lanka also has a very high level healthcare system, isn't it? I think the way that you guys manage COVID-19 pandemic is a good example. So we wish you all the very best for a successful World Brain Day campaign. I'm going to change the discussion to a different direction now. The Darshana, you did a movement disorders fellowship in Melbourne, where I was also working at that time. That's how we got to know each other some times back. And it is visible that you were very passionate on movement disorders. Let's go back a little bit further. Tell me your school days, where you were born and your family background, and what made you to be interested in medicine?
Thank you, Tissa. And yes, when it comes to the past, actually, I was born to an ordinary family in this country, right? My both parents were public servants, and I was born in a very remote area in the country, as you are from Uber. Then shifted, my parents were shift. Thereafter, I entered the normal government schools, right? So as you aware, the governments in Sri Lanka, the education system is 100% free. You have the luxury of having all the education facilities in this country free of charge. So I'm a product of the free education of this country. Then step by step, we came to the ordinary level exams, and I selected the bio stream, which is the entry exam for the biology stream, and then I did the A levels. And as you know, it's very competitive. All from 300,000 students sit for the exam, and only 10% get ability to enter the university in this country, because the university system is also free. And I was fortunate enough to get the cutoff marks and selected to the one of the best universities in this country to do medicine. So at that time, if I go, it was actually going through the exams and enjoying the life as well. So once I got through the advanced level with merits to enter the university medical college, thereafter, after I graduated. So overall, what I feel is the government system made me to become a doctor, which is free. Sometimes if it was paid system, I wouldn't have been a specialist at this moment, right? So which I should be gratitude to the people of Sri Lanka. So it was really interesting to go through that period, as you are also a product of such, as I can guess.
Absolutely, absolutely. I totally agree with all your points. That's one reason that I try to come back to Sri Lanka every opportunity that I get. What inspired you to do neurology as you did your internship? Was there any story that you like to share with us? Shifted you? This is the path that I'm going to choose. I would specialize in neurology. What was that story? If there is such a story.
Yeah, Tissa, regarding that, as you know, in our system, once we get through the medicine, MD part 1, that's the entry exam for the medical medicine stream or the internal medicine stream. We get through a thorough the course for 2.5 years. Then we go through the what we call as the MD, that is Doctor of Medicine Part 2. Then according to the government needs, actually, as I can remember in my exam, there were 30 who got through the MD Part 2, and there were vacancies according to the need of the country. When I got through there were about 12 neurologists for the whole country. So I thought that was a great opportunity to serve the neurology in this country. As you can remember, 12 people is more than a million per people for one doctor. So I think this is the time to change the things. And more importantly, when I choose the neurology, what I feel is a fascinating subject. So still, we have developed MRIs, PET scans, and all these scans, but still, the clinical sense matters, which we can diagnose most of our patients. We are even in but the discussion, Parkinson's is entirely still a clinical diagnosis. So what I feel, which can be in humans with our general touch, with using our all the sensors, which still we can diagnose neurological diseases. The confirmation, it might be need certain investigations like sophisticated MRIs and other stuff. But at even present, what I like neurology was it's still a clinical subject where you can do many more things with your sensors rather than anything else. That was the main the selection. That's what I selected neurology, and I had many opportunities for cardiology, internal medicine, maybe the gastro. Endocrinology was a fascinating field at that time when I selected the neurology. Two reasons, as I mentioned in summary. I want to serve the people in this country, and more importantly, it was a clinical subspecialty where I can use my sensors to diagnose people.
I mean, I like to share a small anecdote from my end. I recall, as you know, I did my medical degree in Wijeratne, Kandy. I was a third year medical student at this point of time, and two stories that I could remember is one is Professor Nimal Senanayake, who is very well known to World Federation Neurology community, well published and well regarded globally. I was fascinated with the way that he would approach certain things. Although by this point of time, he hasn't taught us directly, but I read some of his publications, specifically the way that he sorted out gingerly oil palsy or triorthofacile phosphate. We can talk about that at a different time. Again, case in point is the clinical acumen and investigative mind and that approach. The second incident was I was a student, usually sitting in the back row. I remember two registrars presenting a patient with Parkinson's disease at their clinical grand round and trying to dissect the motor symptoms and demonstrate tremor and shuffling gait and making the clinical diagnosis. In fact, those two registrars, one is a senior physician now, Vasant Disanayake, and the other person is the professor in pediatrics at Wijeratne, Professor Mudianse. So they were either senior house officers or registrars at that time. So those clinical material were tipping points for me at that time to choose. One day I would specialize in neurology. So it wasn't too far for you as well. So then you enter the neurology training. I believe you did your basic neurology or advanced neurology training in Colombo first for a couple of years. Is that the place where your desire or your pre-love to movement disorders born?
Yes, absolutely. When I selected general neurology, actually my trainer and in fact one of my mentors, Professor Ranjani Gamage, when first day when I entered with, she told me, so movement disorders is one thing that many neurologists haven't touched in this country. This is a fascinating field, Darshana, think about that. So that inspired me to go with the Parkinson's patient. Then I started the movement disorder clinic, which was a little bit dormant at that time. So it was a fascinating experience, and it was a clinical diagnosis. And what I understood was, which we can do more and more things for people with suffering from Parkinson's, whether it may be the early stage, late stage, or advanced, whatever it is, there are things that we can offer. So and when we treat the patients, and when they come to the clinic, or when we see in the next visit, the things that we have changed on them, they are the quality of life, the attitudes have all we have changed because of our advice. So because of that, I think it made me to improve my interest in movement disorders specifically. And importantly, then thereafter, I was so lucky to get a fellowship at movement disorders as a movement disorder fellow at Monash under Professor David Williams. It was icing on cake, I would say. It was icing on cake. So that made me a good clinician, I hope so, which to do more and more services to the poor and more deserving people in this country with Parkinson's disease who are suffering very badly, I would say.
And that's where we met for the first time, as I was working in that movement disorders program with David. You basically had an exposure to pretty much everything in movement disorders, from deep brain stimulation, botulinum toxin injections, primary orthostatic tremor. You end up publishing a paper on this topic also later on with the Monash group. So you went back to Sri Lanka. So tell me about your first consultant appointment. I believe you were posted to Anuradhapura.
First I was posted to Badul for a short stint. Then thereafter, my first permanent appointment was to Anuradhapura, which was a
So, what was your experience when you were exposed to those places with fairly limited facilities?
yes, so it was actually, I would say, a blessing in disguise. So to be posted in such areas where the resources was very scarce, and importantly, so for Badul, I was the first neurologist for few months, and after a basic stint, there were no permanent neurologists, and thereafter in Anuradhapura, I was again the first neurologist after for permanent neurologist for after many more years. So I had to start from the scratch, and I really enjoyed. So I started up my general neurology clinics, and then because of my interest in movement disorders, I started a special movement disorders clinic there in about that's in 2010. So it was really gathering momentum thereafter, and then we wanted to start special multidisciplinary meetings with the other allied health staff to make available all the medications. Even in fact, there were not a very organized neurological system when I started working in Anuradhapura. So it was so great when I left that place in 3 years' time. It was so improved. There was a very much neurological services developed, and I was lucky. You also visited many times that place. We improved the actually I started a stroke unit there, as you can remember, with your support, and many experts visited from Australia that place, and thereafter the movement disorder clinic I started and the general clinic. So it has grown in strength after now 10 years when I discussed with my colleagues there. Thereafter, the faculty was there, the Wijeratne medical faculty was also there, which is another blessing in that area. So overall, what I see, being the sole neurologist for the whole province at that time, to the Anuradhapura, what we call as the North Central Province, we started from scratch, which has developed so far, as you know, and importantly, the not only the movement disorders, which is doing great in that area, and over the stroke, epilepsy, and all the other specialties as well, subspecialties as well.
I remember those days very well. I remember the two of us managed to, if I believe if my statistics are correct, we ran a massive stroke master class campaign on whole North Central Province, and we end up training like over 600 doctors and nurses in multiple workshops. And it is pleasing to see that now the people like Hemal is coming to Ragama and giving thrombolysis workshops to teaching hospitals in 2020. So what were the lessons that you would like to share when you are posted to a place with almost no facilities, not even a ward? What do you tell to a new specialist who might get posted to such a place? What would be your advice to them?
The important thing is, the first thing what I want, you have to have a what we call inspiration to start. So even I would have easily left that place and joined the private sector at that time, because there was a very big demand. But what I what I thought was, with the available resources, however they are small, which you can start. Thereafter, gradually with the support of the local, maybe the administrators, the hospital administrators, the government, we can develop step by step. So over the last 10 years, I have viewed that what I started has grown to huge amount. As you mentioned, people like Hemal coming from there and giving talks with the center of the country, or the city of the country, giving how to thrombolyze was great experience. So, but my main message is, have love to the where you work, and with the available facilities, however scarce they are, start it. And then importantly, you can develop from there onwards. There are people who are willing to help, especially in the country, in this country. There are a lot of people who can support, and what you need is the encouragement and the like for the field. That's what I want to stress mainly.
I think the Sri Lanka is such a good example. We can go on talking about the people. I remember you mentioned that Professor Anjani Gamage as one of your early mentors, or who introduced you to movement disorders. Her story is worth sharing also, as much as we know. Is it correct to say that she is the first female neurologist that Sri Lanka had seen? So it wouldn't
Yes,
have been, it would have been not easy to set oneself up as the first female neurologist, not in any country. We hopefully we can share those thoughts some other time. So I think the important thing is to be passionate on what you do, and use the material or ingredient that you have as best as you can, and try to do the best that you can, and then enjoy along the way also. The outside medicine, Darshana, you are married, you have a couple of children, and you are happily married as far as I'm aware. So tell us, how do you spare time when you don't practice neurology, or when you don't do advocacy work with Sri Lankan Neurologist Association or Movement Disorder Society, or any other movements? How do you pass time?
Yeah, this though the time is limited for the activities, but I really love to play cricket. That's what my fascinating is, even up to last, though I am still now reaching 50 years in a couple of years time, I still up to the last year I played cricket for the Association of Sri Lankan Neurologists team, the College of Physicians, something which I from my childhood days I was playing. That's one of the things. And other times I listen for music. You know, the single music is something very unique for me, very close to my heart. So that is something, listening to music. I'm not good at singing or playing any instrument, but I like listening to Sri Lankan, the folk songs and many songs, and playing cricket is my main hobbies or whatever the extra activities which when I have time.
Last but not least, the at global level, global neurology is shaping up very well, as far as I can see. You probably are aware that World Federation Neurology managed to work with almost every other neurological, neurosurgical, psychiatry, trauma, neurocritical care, all those global associations, including Pain Society, Movement Disorder Society, World Federation of Neurorehabilitation, whole variety of them, and then create or establish a platform called Global Neurological Alliance. I personally think the future of neuroscience, or future of clinical neurology, or future of brain health is really, really good. As a neurologist in a country where the services are in the phase of expanding or developing, what do you want these global organizations to do to help countries like Sri Lanka to continue to promote neuroscience, not only in the phase of service building, but education and translational research also? What do you expect these global organizations to do for upcoming young neurologists and countries worldwide to promote neurology as a sort of brain health promoting specialty?
It's very heartening to see that the world organizations are getting together to develop the neurology. When it comes to the country like Sri Lanka, we have the human resources. At the moment, though I told that when I started neurology, I was about maybe around 20th, but now things are picking up. There are about 5 times now in this country. So what we gather is, for an example, if you come to movement disorders, still we are struggling to initiate a program with deep brain stimulation, where in the other part of the world are going far away and even more. So that is one of the things that the things that we don't have actually. In fact, when it comes to the movement disorders, management of Parkinson's, things like initiating deep brain stimulation and the surgical activities, and more importantly, even if you don't go that far, the important thing is to available most of the medications is still a struggle. So those are the things which we support. And above that, I think in addition to that, what we need are the organizations like training our people, mainly in advanced.
Sorry, I lost your voice, Darshana. You have to unmute your microphone again. Darshana, you have to unmute your microphone again.
Otherwise, I think that is the most encouraging thing that I want to see from the world organizations to the countries like Sri Lanka.
Darshana, it is pleasing to talk to you as usual. Thank you very much for all your hard work, and continue to improve neurological services among fellow Sri Lankans. And wishing you and your teams and your colleagues all the very best. And we look forward to reading about a fabulous World Brain Day activities and fabulous World Brain Day program from Sri Lanka. Later on, as you are well aware, you can submit a report to World Neurology you can write to rest of the other publications also. Thanks very much, Darshana. All the very best.
Thank you, Tissa. It was so privileged to talk to you, and I am really looking forward to the activities. I am sure if we once stop by the World Brain Day activities, the movement disorder work will carry on from strength to strength. Thank you very much.
In fact, you made a very good point. Since last year, what we have done is we run almost a year-long World Brain Day campaign. Although we dedicate main activities around 22nd of July, we are active from now onwards, and we will continue to be active throughout the year with a big virtual press conference being planned at the upcoming Movement Disorder Society also. So it is a long-lasting campaign, and the WFN and MDS is right behind on this long-lasting campaign as raising awareness and promoting the good advocacy to get the best possible care for our patients is of highest priority worldwide. And the other good thing that I like to remind you is, yes, we can't travel these days. Yes, we are stuck where we are. However, the pandemic has created a good thing also. You probably have not heard this. We recently concluded European Academy Neurology virtual conference attended by over 40,000 people. And as you know, the Movement Disorder Society annual Congress is going to be virtual this year, and it will be free. My prediction is that we would have a record-breaking turn up of neurologists and other like-minded people for the Movement Disorders Congress. So at least as far as I can see, the education opportunities have become equal all over the world thanks to internet. So good things are happening despite the pandemic. So let's be hopeful that we would continue to see a better world in time to come. All the best, Darshana.
Thank you, Tissa. Thanks.